Water, sanitation and hygiene services are said to be the most essential means to combat antimicrobial resistance, ensure infection prevention, and provide safe environments for maternal and child care. This session on water, sanitation and hygiene in healthcare facilities, led by the co-chairs of the United Nations Group of Friends of WASH in healthcare facilities, which are Hungary and the Philippines, focuses on the progress made towards achieving the targets set out to improve WASH in healthcare facilities.
I think this is so obvious, so minimum, that sometimes we forget the obvious. So no way, if you are embarking on a construction of a healthcare facility, if a donor, if a supporter, if anyone at the government decide to do a healthcare facility, make sure that it will be equipped on a mandatory basis of the minimum to operate and to provide care to your people. That will be the first one. Not having WASH services is unacceptable everywhere, but not having WASH services at the healthcare facilities, I don't know what. I don't have a word. I have some words, but are not very nice, so maybe I should not give it here. Today, the world is dealing with a pandemic treaty. We want to prevent the occurrence of new pandemics, new infectious diseases spreading. Let me tell you something. Let's go to the basics. If we don't have the basic investment on water and sanitation, there will be very little we can do to prevent the spread of infectious diseases.
We know that improved access to WASH and improved health are inextricably linked. As such, we work to ensure that WASH is integrated into healthcare facilities, that everyone can have high-quality health services and improved experiences.
That WASH is an integral part of global efforts to achieve universal health coverage. The universal health coverage must also mean universal access to WASH. This is the only means to ensure health outcomes for our patients, improve response to outbreaks, and contribute to healthier and more productive communities in line with the Sustainable Development Goals. WASH must be strengthened at community level. The community health facilities and health workers have an important role to play in all phases of disease management. Their local knowledge, cultural awareness, and capacity need to be leveraged for greater trust, access, and to strengthen resilience. And we know that interventions that are locally driven and take into account specific contexts promote a culture of quality and ownership and reach those that are often left behind.
Nigeria expects partners to engage relevant agencies of government in the country to drive the realization of WASH targets in healthcare facilities.
We need to also get it right in terms of WASH, because we believe if Nigeria has able to get it right, our neighbors within the African community will also buy in. This is critical in terms of new innovations and also research and development and capacity building. Why we are very strategic in Nigeria as a regulator is we have about 50,000 practitioners who are down the line. What I mean down the line, they are found in the community, and also most of the health facilities, because of the national policy in Nigeria, has made it mandatory to establish the environmental health department and units depending on the carrying capacity of the health facility. So I want to encourage and call WHO, because I heard that they are in Nigeria, and I believe the right people that they need to work with in Nigeria is the council as a regulator, because we regulate the practice and we also regulate the practitioners. Likewise, the action aids, we heard that they are in Nigeria too. We are extending our hands of fellowship. Please, they should come and work with the right group in Nigeria.
At another side event of the UN Water Conference organized by the United States Chamber of Commerce, Nigeria made a case to host the Secretariat of the Global Action Plan of $3 billion WASH program for developing countries. 17 investors in WASH also indicated public-private partnership initiatives to drive WASH implementation in Nigeria. Onengiye Fine Face, NTA News.